Hello, my name is Peter Harvey. I am owner of Eastern Healing. We specialize in treatment of infertility and female health. And with me today is Dr. Meike Uhler. She is board certified in reproductive medicine, and she is with the Fertility Centers of Illinois. Our topic for today is going to be understanding fertility and what are some of the options for couples that are out there. Dr. Uhler, how are you doing today?
Hi, Peter. Thank you for having me here.
Sure, I'm glad you're able to come by. First off, for this video, I want to try and inform the public out there as to what options are available to them. How common is fertility or infertility with couples?
Yes, it depends a lot on the age of the patient, but we do say as a general, broad term that 15% of all couples are affected with infertility. And we do expect most people in their early 20s, even early 30s, for 85% of them to get pregnant after they try for 1 year. And then after the age of 35, we do ask them to come in for an evaluation after 6 months because age is increasing. But we do think that 15% of the population is affected by infertility. And in the United States at this point, it's about 7 million people.
Wow, that's quite a big number. Quite a big number. Are you expecting that to rise in the coming years?
You know, it has over the past several decades, and we think this is because many women are waiting to get pregnant longer until they are done with their careers, they find a partner. Some of it is due to an increase in sexually transmitted diseases in this country. Part of it is also because we have excellent contraception and women can just wait and contracept until they're ready to get pregnant. So it is rising since the last several decades.
So what are some of the other common causes of infertility you see?
Well, infertility, if we look at a couple, we can break it down to about 40% of infertility is due to the male, and then about 25% is due to the woman who is not ovulating on a regular basis. Probably another 20 to 25% is due to pelvic disease, such as pelvic adhesions, endometriosis, problems with the fallopian tube, so an anatomic reason, and another 10 to 15% is due to unexplained infertility. So that is the breakdown for causes for infertility.
Okay. How important is age, or how does age factor into fertility for couples?
That is a really good question because age is probably the single most important factor for determining success with pregnancy. And we know that as age increases, the rate of infertility increases, and therefore the chance of success at pregnancy decreases. So it is very, very important.
Wow. So what type of tests, if a couple comes in to see you, what type of tests do you typically do? I know at our office, when a couple comes in to seek counseling, and if they want to use traditional Chinese medicine, we don't do MRIs or blood tests, but typically we interview them. We want to find out their whole health history, find out what their diet is like, adjust it, see what supplements they're on. We may look at their tongue, feel their pulse, and go from there. But for Western medicine, what are some of the common tests that you do?
For couples who come into our office, we actually prefer to interview both the husband and the wife, so we can ask them each separately, ask them questions about their health, general health for both of them. So for the patient, we ask usual questions regarding her menstrual cycles, past obstetrical history, past medical history, any medication she is on, any prior testing she's had. What are her lifestyle? We do ask if she smokes. What is her family history like in terms of cancer risk? For the husband, we like to ask the same questions. What is his medical problems like? What is he on any medications? Has he ever had any surgery? What problems has he had in the past? So we find that taking a history from both of them is very informative.
Is it pretty comprehensive? Are they there for a long time doing this history? Is it?
I think if it's a fairly straightforward history, I would say between 30 and 45 minutes.
Okay.
We would ask them. Of course, if they come in and they've had a prior history of infertility in the past, we might have to review the records. Might take a little bit longer.
Right. Okay. And once you find out what you think is going on with the couple, what are some of the treatment options for a couple when they first come in?
Well, first we like to do a diagnostic evaluation, so we'll run tests on them. And what we usually do, because of the reasons for infertility, we had mentioned male factor being 40%, we do order a semen analysis on the husbands, and then we look at the patient and we order baseline hormonal testing to evaluate for her ovarian reserve. So that would include an FSH level and an estradiol level on day 3. An antral follicle count, which is where we take a look at the small number of follicles at baseline ultrasound so we can see how many that patient has to begin with. And we may do other testing depending upon her symptoms, such as her thyroid, her prolactin level, another blood test called an anti-Müllerian hormone. So it depends on what else she presents with. Also, we would do an assessment of her anatomy. So we would have an ultrasound to take a look at her ovaries, her uterus, usually a saline ultrasound to take a look at her uterine cavity and fallopian tube. So we do want to assess the entire anatomy. Additionally, before patients get pregnant, we do think it's important for both the husband and the wife to have a basic, what we call prenatal package. So we want to double check the wife, her blood type. Is she immune to German measles? What is her blood count? Do they have any genetic screening that we need to do? So if a patient for whatever reason carries a certain genetic trait for disease, then it is important we find that out before she gets pregnant. So they are offered genetic screening in our office, as well as screening for sexually transmitted diseases and basic blood work before they get pregnant.
Is insurance covered by a lot of this, or is it all out of pocket for patients?
It really depends on several different things. Illinois is a state-mandated coverage for infertility. So what that means is infertility, to a certain extent, is covered for most people, but there are loopholes to this law. So, for instance, if a company has less than 25 employees, then they don't need to necessarily adhere to this state mandate. If the headquarters of the company is outside of Illinois, they do not need to adhere to it, or if they're a privately owned company. So it depends. But some people have very good coverage, and that would include both diagnosis and treatment. Other people have only diagnostic coverage, in which case we can make the diagnosis, but then the treatment would not be covered. And other people have no coverage at all. So I think the patient really needs to check her insurance and see what kind of coverage she has.